NCDs are national coverage determinations. NCDs are released by Medicare, and they apply to all providers who provide any kind of services to Medicare beneficiaries. Local coverage determinations, or LCDs, are actually generated by the different Medicare administrative contractors, and those will apply then only to specific jurisdictions within the country. There's a number of challenges that you're going to find in trying to use these documents off of the CMS website. One of the first things is that they're very difficult to locate. There's limited search features on the CMS website, and you really have to understand jurisdictional rules before you can locate the document that you want. Once you find the actual document that you want to review, they're really not set up in a way that makes them user-friendly. So there'll be a combination of both clinical information, but also some background and general Medicare information, things that are important to know or things that providers may want to know, but are not clinically relevant when they're deciding whether or not a patient needs a service. And so sometimes just sorting all of that information out into what you need to know about your patient versus what you need to know about the Medicare program in general can be really difficult for both providers and payers. There's really three different values that we offer. So first, it's going to make locating these documents easier. They're able to use the geographical search to limit the number of LCDs or NCDs that are returned to them when they're doing a search. We provide them, though, all of the LCDs for all of the jurisdictions in case they need an additional one. It's going to present this information in a format that's familiar to our payers because everything's been converted, all those clinical elements have been converted into clinical logic. And then we've separated out what is the true clinical part of the guideline from what is that other general background information or Medicare billing information. If it's clinically relevant, it's included in the clinical logic. If it's additional information that's good for that payer plan to know, we've kept that in the MCG guideline, but we've moved it out into footnotes and other places. So if the plan wants to operationalize it, they can, but if they don't need to, they don't have to. For providers, they are going to get a product that's really clean for them and very clinically relevant. They're going to have all of those components that they need to make good clinical decisions in the clinical logic for them, so it's really going to support their clinical decision making. It also allows them to have a similar language with their payers when both the payers and the providers are using the same kind of content. And then again, if there's additional information or additional references that they need to know, we've included that in the LCD content, but separated it from the clinical logic to make it easier to locate.